Hi guys, welcome to the very last day of material for the class. Woo, we made it! So today I'm posting the lecture series on hallucinogens, and then on Friday the 16th will be our live class review, so if you have any questions you can ask them there. I'll tell you a little bit about what the exam is going to look like. I know that I'm behind on emails right now, so please give me a minute to catch up on those, but all questions will be answered by Friday at the live class. So, let's now get into hallucinogens. So what are they? This is a very broad category of drugs that have a convergent effect. So, they generate a perceptual and cognitive distortion, and there's an absence of toxic delirium happening. Now, there's a lot of different terms for this group of drugs. You might have heard of psychomimetic. We don't usually use this term anymore. We use the term because we thought these drugs mimicked psychosis. However, now we know that it's not an accurate depiction of psychosis. So the two more popular terms we use are psychedelics. So that's referring to like mind opening. So that's the most common term used if you're talking about these drugs recreationally or in a clinical context. And then we've got hallucinogenics, and this is the preferred term when you're talking about them as a drug, so pharmacologically. And we got this word just because it means producing hallucinations. Now, there's 4 different drugs that we're going to talk about that fall in this category. We got mescaline, LSD, DMT, and psilocybin. So we'll go through each of those a little bit and just what they are, how they differ a bit. So first we've got mescaline. This is a psychoactive alkaloid that's found in the peyote cactus. So this is what it looks like. It is native to Texas and Mexico. There's a long history of use of peyote in indigenous cultures, and there is an entheogenic effect of peyote, so this is used in some transcendent rituals. Now, when I say entheogenic, I'm talking about like generating the divine within. That's kind of the idea. So it induces a sense of transcendence or spirituality. And that's what peyote has been used for a lot. And we've actually found that peyote buttons have been found at archaeological sites all the way from 3800 BCE. So it's been used for centuries. Now, the next drug is psilocybin. Psilocybin, depends how you pronounce that. Here we've got endogenous active alkaloid, prodrug found in the mushrooms, specifically of the genus Psilocybin. So you can see how we get our name. Again, extensive history of use. However, there's more of a broad geographical area where we see use of this, as it grows in a larger area than peyote. So we see continued use in the Central American cultures. There's been cave drawings depicting ritual mushroom use in Algeria. And so psilocybin is metabolized to psilocin, which is the psychoactive metabolite in the body. So you can probably guess we're going to bring that term back up later. Next, we've got DMT, or dimethyl tryptamine. So it is a psychoactive tryptamine found in South American vines. Traditionally, it'll be brewed into a tea called ayahuasca. So that kind of roughly translate into vine of the soul. It is only psychoactive when brewed with these vines, which contain beta carbolines. So these are reverse MAO inhibitors. So beta carbolines are proposed to inhibit the first pass metabolism of DMT, thereby allowing DMT to go on and have this psychedelic effect. So it can be purified, or there is synthetic DMT that can be smoked as a street drug. Again, by doing it this way, it bypasses that first pass metabolism. Now, DMT is also entheogenic. It has an endogenous bioactive amine that's also found naturally in the human brain. So you can probably guess how that's going to bind and interact in the brain, because we have that endogenous connection. And then finally, arguably the most well-known, most talked about hallucinogen would be LSD. So that's lysergic acid diethylamide. It was famously synthesized in 1938 by this dude called Albert Hofmann. He discovered the effects accidentally in 1943. We see some lysergic acid is the chemical precursor to the ergot alkaloids. So it's the potent toxic found in parasitic fungus that will then infest rye and beet crops. So it actually may have caused many deaths in the past, this potent toxin. But by kind of like altering it, then we're actually able to use this toxin to create this hallucinogenic. So ergot alkaloids have a medical use, as they actually induce powerful uterine contractions. So in the past, it has been used to induce labor and reduce that post-birth hemorrhage. Now, Albert Hofmann, further to his discovery of the psychoactive effects, then he did self-administer a dose of 250 micrograms. So it's that's 3 to 5 times larger than even a recreational dose. And after the ingestion, he actually somehow managed to bike home, marking the first intentional LSD trip. Get it? Because he went on a trip? Funny. So it's celebrated by the community of LSD users as Bicycle Day, the day that he did this, which was April 21st. So, day after your exam, guys, is Bicycle Day. Who knew? Now, what's some more history? So, what's really cool is that the study of hallucinogens actually connects to Canada. So, there's this dude, Dr. Humphrey Osmond, and he helped coin the term psychedelic. He was a psychiatrist, and he also helped create the Saskatchewan Hospital, and helped develop the psychiatric hospital in Saskatchewan, where they used LSD clinically, as well as other hallucinogens. So that was pretty cool. It was recommended for therapy to uncover repressed thoughts and feelings. Also, side fact, the hospital, the Saskatchewan Hospital, when it opened in 1921, was the largest building in the British Commonwealth, and also the most expensive building to build in Saskatchewan at the time. Obviously, it's not anymore, but still pretty awesome. So, our friendly Canadian fellows helped develop the use of hallucinogens for therapy. So there's psycholytic and psychedelic therapies. So again, Osmond was a pioneer in the use of LSD as treatment. Specifically, he looked at it for use for alcoholism, initiating studies at high doses, attempting to recreate the withdrawal symptoms that delirium tremens hallucinations. And one of his subjects actually included this guy called Bill W., who was a co-founder of Alcoholics Anonymous. I just have all the fun facts, guys. So, let's talk specifically about psychedelics and psycholytics. So the use of LSD is as a psychomimetic gave way to ketamine or PCP, and because people realized that LSD doesn't accurately mimic psychosis. So psycholytic therapy involved a low dose of LSD that would promote the release of repressed memories. And then psychedelic therapy became increasingly popular in the 50s and 60s. So with psychedelic therapy, then you used a high dose of LSD, and this would induce a spiritual experience. So patients would use this to kind of gain insight into something. And it was studied for treatment of alcoholism. Of course, there were lots of inconsistent results, very poor experimental designs, so really didn't get off the ground too much. There is a current resurgence for end-of-life trauma, PTSD, addiction, and treatment-resistant depression, and how LSD and other hallucinogens may help that. The self-reported spiritual experience does correlate with increased treatment efficiency. So the more likely you are to experience a spiritual experience while on LSD, the more likely LSD will help you as a treatment. So, how did the psychedelic culture really come to be? How did it get introduced to the Western world as kind of like a recreational drug or even use as therapy? So there's three guys that really helped lead the reintroduction of hallucinogenics into the Western world. The first was Aldous Huxley. And so he's actually the grandson of Thomas Huxley. If you took evolution class, and you might remember his name, he was a outspoken supporter of Darwin. He was friends with Darwin. But his grandson, Aldous Huxley, is well known for his science fiction novel Brave New World. And he actually depicted his experience with mescaline in the 1954 essay, The Doors of Perception. So it was really popularizing the use of mescaline. Next, we've got Gordon Wasson. He was a banker and amateur mycologist. So he was the first known Westerner to participate in a Mazatec mushroom ritual. And he then later published this account in an article. And then we've got Thomas Leary. So he was a clinical psychologist. He worked at Harvard. and he experienced mushrooms in Mexico while on vacation. He then went on to found the Harvard Psychedelic Drug Research Program, which administered psilocybin and LSD to a bunch of grad students and faculty, and then saw what happened. He was then later dismissed from Harvard, because, you can't really drug your students. But he did then continue his work privately. And Leary was certainly influenced by the writings of both Huxley and Wasson, and they were then both also highly influenced by Osmond. So Huxley corresponded with Osmond and actually went and visited him. So that's pretty awesome. So another thing that we'll have to talk about when talking about hallucinogens is Project MK Ultra. So Sidney Gottlieb headed MK Ultra for the CIA. It was a series of illegal human experiments in the 50s to 70s, where they wanted to investigate the potential methods for mind control and interrogation using hallucinogens. So again, this was all very illegal, very clandestine. A lot of people didn't know about it until later on. So they extensively investigate the effects of LSD on servicemen and sometimes on members of the public without telling them. They would literally just go around drugging whoever they wanted and saw what happened. There were several plans to assassinate world leaders using their knowledge, using MK Ultra. Specifically, Fidel Castro was one of their targets. They tried to kill him with high doses of LSD several times. Nothing really came about to it. CIA is notoriously awful at assassinating Fidel Castro. They've tried like over 80 times, never succeeded, and he died by himself. So MK Ultra itself refers to the internal codes for funding from the technical support, and Ultra being the highest level of secret. Other than LSD, they did use hypnosis, sensory deprivation methods, verbal and sexual abuse to try to manipulate people's mental states, as well as being done in the U.S. and trying to assassinate international leaders. They actually did fund some research out of McGill that used clinical patients that usually had minor problems like anxiety or depression, and tested different techniques on them. So they didn't just stick to the US. So that's it for kind of like the history, the background of our hallucinogenics. In the next video, we'll talk about the pharmacology, the drug effects, etc.